Good morning, guys. I'm going to hurry and record this lecture. I was supposed to do it last night, but I didn't get it done. So we're going to do it here this morning. If I'm posting it a little late, I also apologize for that, but it's all right. If you have any questions, feel free to reach out. This is a large slideshow, but based on the number of class periods we have left, I'm going to have to buzz through this. So, this may be one of the longer videos, be aware of that, but it's going to be okay. Okay, so when talking about sudden illnesses, the first thing we're going to talk about is an unexplained change in responsiveness. Now, we've talked a lot about this, but a little more specifically, the four different things that we look into to see how responsive a person is. So, if somebody's alert, they're totally responsive, right? Like they're talking, they're up. Then there's verbally responsive, so they're not moving, but they can talk. Okay, or they respond when you talk to them, is what that is. Ignore what I said the first time. They won't respond until you say something to them. Okay. Then there's painfully responsive, and that is if they respond to pain. So we talked about doing like a sternal rub. You can literally pinch somebody, things like that. If they respond to pain, then they're painfully responsive. So maybe they wouldn't respond initially to if you were to talk to them, but they would respond to the pain. And then you have somebody that's just completely unresponsive that won't respond to anything. So now we're going to get into a few different causes of that. So this mnemonic STOP offers some ideas of what could be some of these changes in responsiveness. So when talking about the S, it could be sugar, which has to do with diabetic people. Seizures can cause unresponsiveness. A stroke could cause unresponsiveness, and then shock could also cause unresponsiveness. For T, if somebody gets heat stroke or their temperature is too low, so the T is temperature, that could also cause unresponsiveness. The O stands for oxygen, so if they're not getting adequate oxygen, that could cause unresponsiveness as well. And then last but not least, you have P, which stands for poisoning or pressure on the brain. Now those things, obviously poisoning is poisoning, can be caused by a number of things. But it also includes drug and alcohol overdose, carbon monoxide poisoning. And then the pressure on the brain is typically from a head injury. All right. So when talking about sudden illnesses of the heart, the first one is a heart attack. And I know we've talked about this. I do like this visual, though. It's when there is blood flow cut off to the heart itself. So another name for a heart attack is called an acute myocardial infarction. It's kind of funny sounding, but caused by plaque buildup or some sort of a clot in the arteries that go to the heart. Okay. Now, atherosclerosis is another name for plaque buildup in the arteries. So that's what this is showing, is some of that plaque buildup. And then this here is showing the actual clot. And this darker tissue right here is where the heart tissue starts to die. So that's, another visual of what a heart attack will do. we've talked about heart attack and cardiac arrest. Heart attack is when um, the blood flow to the heart is cut off. That's causing the heart tissue to die. Cardiac arrest is when the heart stops. Now, a heart attack will eventually lead to cardiac arrest, but cardiac arrest isn't always caused by a heart attack. It can be caused by other things like irregular rhythm, um, can be caused by shock, lots of different things. So, some signs and symptoms of a heart attack: chest pain, sweating, lightheadedness or dizziness, nausea or vomiting, numbness, aching and tingling in the arm, especially the left arm, shortness of breath, weakness or fatigue. Make sure you put a star by those. Those are going to be a quiz question. Okay, now what to do? You want to have the person sit down with their knees raised, lean against some stable support, and call 911. The fact of the matter is there's not a whole lot you can do about it. Um, you just want to comfort the person until EMS can get there. Loosen tight clothing. Um, make sure really that they're comfortable. Um, if they take medication for a heart condition, have them take it, help them. Um, if they're alert and able to swallow, you can give them an aspirin. We talked a little bit about this a few classes ago. Um, aspirin is an NSAID, a non-steroidal anti-inflammatory, and it acts as a blood thinner, so it can help thin out some of that clot that's in the coronary artery. Um, so that's something you can do. And then also monitor their breathing to make sure they don't become unresponsive, or so that you would be ready to perform CPR. So now we're going to talk about a condition that's called angina. Basically, what it is it's chest pain. It's like a kind of like a symptom of a heart attack, but it's not always a full blown heart attack. So it's chest pain that comes when blood flow to the heart musculature is restricted. So those coronary arteries are either, one of them is either cut off or only partially cut off. Um, and the coronary arteries start to become narrow, and it just causes chest pain, pain right over your heart. If they can't carry sufficient blood um, to the heart itself, a lot of times this will happen during physical activity. Somebody gets really excited and their heart starts to race, or if they're emotional, eating a heavy meal could cause this. Extreme temperatures and cigarette smoking. Um, and because of that, it causes this chest pain. Um, some drugs that can affect the blood supply. So coronary vasodilators and nitroglycerin both help to restore this blood flow to the heart. Um, so they can be useful in somebody that is experiencing this angina. Now, some things to look for. It'll feel like crushing or squeezing. Like some people say, like it feels like an elephant sitting on my chest. Um, the pain can spread to their jaw, their arms, even their mid back, and it can last anywhere from 3 to 10 minutes. Now, nitroglycerin is a really good medication to give this person to help restore this blood flow. So, what to do? Have them sit down, relax. If they have some prescribed nitroglycerin, have them take it. Um, And if the pain doesn't go away after 5 minutes, give them a second dose and call 911. And if there's still no relief after 5 more minutes, even if EMS hasn't come yet, give them another dose of the nitroglycerin. All right. So now we're going to talk about stroke. A stroke occurs, it's just like a heart attack, but in the brain. So when blood flow gets cut off to a certain part of the brain, it can cause damage to the brain, right? When that brain tissue is no longer getting blood flow, then the tissue starts to die, and it happens pretty quickly. So, depending on the part of the brain that gets affected, it can cause different symptoms. So, like if the speech center is affected, then they won't be able to talk very well. If the motor center of the brain is affected, then it will be difficult for them to move, those kinds of things. Now, the effects are relatively permanent. There are some people that may never regain some of those functions, but there are others that can regain at least part of those functions. Now, there's two types of strokes. An ischemic stroke is when there is narrowing or a clog of one of the arteries in the brain, and a hemorrhagic stroke occurs when there's a blood vessel rupture, and that is typically more traumatic, like getting a severe concussion or if there's an actual head injury. So, transient ischemic, a transient ischemic attack happens when part of the brain is deprived of oxygen long enough to cause symptoms, but not necessarily long enough to cause permanent damage. This will usually resolve within 24 hours. Some of this could happen from, um, having low blood pressure, going into shock, those kinds of things. So the person is deprived of blood flow to a part of their brain for a moment, but not long enough to cause actual damage. So, for a stroke, some things to look for. You use the mnemonic FAST. Okay, so face. A lot of times, their face will droop. Okay, arms. Their one of their arms, depending on which side of the brain is affected, the opposite arm will become weak. Speech, they're not going to be able to talk very well. And then time. Speaking about time, it means you need to act quickly. So not only do you need to move quickly, but I've told you guys a story about the stroke patient that I dealt with early in the semester. It's also important that you try and narrow down as close as possible the time when all the symptoms started. That changes the way they can treat the person and how they can help the person if you know exactly when it started. But also acting very quickly is also important. So, what to do? Call 911 immediately, as soon as possible. That is first and foremost. Monitor their breathing, making sure that they stay responsive. Be prepared to turn the person on their side if they're going to vomit or throw up. Put them on their back to help them relax, and then loosen tight or constricting clothing. Make sure you guys understand that mnemonic FAST. That is going to be a quiz question. Now we're going to talk a little bit about asthma. So asthma is a lung disease that causes the airways to inflame and narrow. It can cause periods of wheezing, chest tightness, shortness of breath, and coughing. Now, for some people, it's more like exercise induced. Some people can be kind of random or caused by like dust, allergens, those kinds of things. So here you go. Some common triggers. If it's environmental, it could be like cold air, the house dust mites, animals, like wood burning stoves, air pollution, those kinds of things. It could be caused by drugs or chemicals like aspirin or a beta blocker, food and drug preservatives, and then some different conditions or events. So, like throwing up, gastroesophageal reflux, that's what that is. Allergies, panic attacks, pregnancy, a woman's period could cause asthma, an asthma attack. Any of these really can be triggers. So some things to look for if somebody has frequent coughing attacks, wheezing when they're breathing, having a hard time breathing. They're not able to speak in complete sentences without stopping to take a breath. You could also just be in really bad shape, like me. Or sitting in a tripod position. I'm going to look that one up. So, advantage of recording class. I hurried and paused the recording and looked up the tripod position. So the tripod position is essentially just when you're leaning on your knees, sitting down, leaning on your knees, things like that, to help calm the breathing and help you to breathe a little bit better. So, what to do next? Put the person in an upright position, have them breathe slowly and deeply. Ask them if they have asthma medication. If they have a rescue inhaler, they'll know how to use it. Help them. If they need help, call 911 immediately if there's no improvement after using their inhaler, or if they get repeated attacks back to back, or if it's a really bad or a prolonged attack that just won't stop. So next, hyperventilation. Hyperventilation is where you're just breathing quickly. It's common during emotional distress. Can also be caused by some other things like untreated diabetes, severe shock, certain poisons can cause it, brain swelling, and high altitude. So essentially what happens with hyperventilation is, for those of you who have taken physiology, or when you take physiology, you'll learn more about this, but we always talk about like you breathe out CO2 and that it almost makes it seem like a bad thing, but you have to have a balance of CO2 in your blood for your body to work properly. And so when there is not a balance, when you're breathing so quickly and there's a lack of CO2, it causes issues in your body. And can be not good. So some things to look for: if they're having shortness of breath, they'll be breathing fast, but it's like they're not getting enough. There could be tingling and numbness of the hands, feet, and around their mouth, and they can be dizzy and lightheaded. So what to do for them? Try and calm and reassure them. Take them to a quiet place. Encourage them to breathe more slowly, in through your nose, out through your mouth. Have them hold the breath in for 1 to 2 seconds and then breathe it out slowly. Okay. Now we're going to talk about COPD. stands for chronic obstructive pulmonary disease. It's kind of a broad term that applies to a few different things like emphysema, chronic bronchitis, or other lung diseases. Basically, what it is you can get a buildup of like mucus in your lungs, and it can be really difficult to get it out. Um, with COPD, though, sometimes they'll use things like so like in kids, when younger people get COPD, what they'll do is they'll literally put like a vest on them that shakes. It causes some pretty violent shaking to help break up the mucus in their lungs so that they can get it out. Um, yeah, kind of interesting for sure. I remember when my son was in the hospital that there was a kid in the room next to us, or they had like rooms that were shared, that they just had like a curtain that would divide it in half. There in the pediatric ICU, um, and the kid in the room next to us had COPD, and what they would do is they would give him like a medication to help break it up, and then they would literally just pat his back for like 5 to 10 minutes, fairly hard, just to break that up, and then they would help suck it out for him. I mean, obviously this kid was an infant, was a little kid, but kind of an interesting deal. So the most common factor in older people is cigarette smoking, and it's most common in people over 60. So some things to look for would be wheezing, coughing, shortness of breath, lots and lots of mucus, um, and they may have oxygen already. So like they may have a tank with them, or they may have like a portable um, oxygen machine. So some things to do: help them take medications if they have them, put them in a comfortable position, encourage them to cough, cough up those secretions if they're coughing, um, encourage them to drink some fluids. And then for acute distress, so meaning like they're having like almost like an asthma attack, like having a really hard time breathing immediately, get immediate medical assistance. Fainting. So fainting can occur as a result of a lot of things. Um, I hope we all know what fainting is. Basically, it's just a quick loss of responsiveness, so they're just all of a sudden unresponsive. But it's typically not associated with a head injury. It can also be called syncope or vasovagal syncope. Um, most fainting episodes happen because of a decreased blood flow, especially to the brain. Decreased blood flow can be caused by a slow heart rate, heart rhythm changes, dehydration, anemia, which is just low red blood cell count, um, bleeding, sitting or standing for a long time, like positional changes can cause fainting. And then you can also get it from decreased glucose, so low blood sugar. Can be caused if somebody takes too much insulin, or also infections can cause a decreased blood sugar. So, what to look for? For a person who suddenly collapsed, um, check to see if they're motionless. And then, of course, we're going to do the normal things that we would, check for breathing, check for the different types of responsiveness, like if they're responsive to pain, those sorts of things. If a person feels like they're about to faint, because most of the time they'll know, um, they may have pale skin or lips, clammy or sweaty skin. They may be shivering. They may be shaky and unsteady. They may also feel like hot or super cold. They may report like ringing in their ears, dizziness, abdominal pain, or they may not be able to see very well. So what to do? For somebody who has fainted, like I talked about, check their breathing, um, check their pulse, check their responsiveness, and then call 911 or give CPR as necessary. And then for somebody who is breathing but unresponsive, we've talked about that. Put them in the recovery position. Um, Treat any injuries that may have been caused by the fall. You can wipe their forehead with a cool, wet cloth, um, and continue to monitor them until EMS arrives. And yeah, I already talked about this. So, if they don't wake up or don't return to normal when they wake up, call 911. If they have repeated fainting episodes, call 911. If they don't regain responsiveness very quickly, you're going to want to call. Um, if there's really no reason at all for this person to faint, then they need to be seen by a doctor. And that doesn't necessarily mean you have to call 911. You could just transport them. But if any other symptoms arise that are concerning, you'll want to call 911. If they have diabetes or have a history of seizures, if they're pregnant, um, if they are incontinent or they can't control their bladder or their bowels, or if they're older than 50, then you need to call 911. If somebody's about to faint, sit them down. Don't just hold them up. Sit them down, lay them down to reduce the risk of falling. You can also use what's called physical counter pressure maneuvers. So it's like a push and pull type maneuver. So you just tell the person to like clasp their hands together and like squeeze their hands together as hard as they can. Um, that's called a physical counter pressure maneuver. Um, Kind of messes with some of the blood flow and some of the pressures in your body. It can help stop a faint, somebody from fainting. If you're suspecting a heart attack or a stroke, don't do that, um, because it messes with the pressures in your body. It can make those things worse. Call 911 if there's no improvement within 2 minutes, or if it gets worse or happens again, and then monitor their breathing. So seizures. Seizures happen when there's an abnormal firing in the brain of the brain signals. Um, Usually, I mean, most of us I think know what a seizure is, but it'll cause like somebody to have like jerking movements, and then right after they'll go unresponsive. There are different types of seizures. There's like very small seizures, and then there's actually like really bad ones. But they can be caused by different things. So some conditions that can lead to seizures: lack of oxygen, heat stroke, poisoning, severe electric shock, hypoglycemia. Children that get a fever high enough can have a seizure, a brain injury, a tumor, a stroke, and then anything to do with alcohol or drugs, withdrawal or alcohol poisoning, um, yeah, those kinds of things. So for a convulsive seizure, where somebody is actually convulsing and the rapid jerky movements, so some things to look for is they'll fall to the ground, their arms and legs will stiffen, and then they'll have the jerky movements. They may foam at the mouth or grind their teeth. They may have blue or gray face or face and lips, um, like cyanosis. Their eyes may roll upward, and they may lose control of their bladder or their bowels. Okay, so a non-convulsive seizure really only lasts a few seconds. It will honestly just seem like they just like you've seen those people that stare into space and then all of a sudden they're just like it's like they've gone to another world for a moment. That's kind of what a non-convulsive seizure can look like. They may have some frequent eye blinking, like blink really quickly, um, and some involuntary movements. It just won't look quite like what a convulsive seizure would. So, if somebody actually has a seizure, the first thing you're going to want to do is move nearby objects to prevent them from like hurting themselves, hitting something. Place something soft under their head to protect their head. Time the seizure. That plays a big role in how they treat it. And then try and keep bystanders away. It can be a very embarrassing situation for that person when they become responsive. And so avoid having like lots of people standing around um, to protect that person's privacy as well. So call 911 if the seizure lasted longer than 5 minutes. If there was like a series of seizures, if there's any breathing difficulties after the seizure, if the person has diabetes or is pregnant, if it happened in water, if this is the first person's first seizure, you have to call 911. If there's any injuries that cause the seizure, or if they just have a really hard time recovering. So after the seizure, make sure their airway stays open, monitor their breathing, give CPR if necessary. It's okay to let the person sleep and stay with them until they fully recover. So if it's a prolonged seizure, um, it's called status epilepticus. Um, it requires immediate medical care, and it can lead to brain damage, fractures, severe dehydration, and aspiration. And then, okay, now we're going to talk about diabetic emergencies. So, insulin is a hormone that's produced by the pancreas and helps to um, help the body absorb sugar from food. Okay, so diabetes happens when insulin is either no longer effective or there's not enough. So there's two types of diabetes. Type 1 diabetes is usually diagnosed early in a person's life. That's when they do not create enough insulin. Um, and so they have to take insulin in order to effectively um, use the sugar that they intake through their food. Type 2 diabetes is caused by excess body weight and a sedentary lifestyle, so not an inactive lifestyle. And that's caused when basically the insulin isn't effective in uptaking the sugar anymore. So, there's also gestational diabetes. This happens in pregnancy. Some women get it, and so they have to be careful with their diet. Um, but it usually only lasts during pregnancy. And so they'll test for it in every pregnancy. They'll have the woman like eat a candy bar and then they'll test her blood sugar and it will help them determine whether she has that or not. So for low blood glucose or hypoglycemia, that's if there's too much insulin in the blood, or they haven't eaten enough, or they waited too long to eat. Exercise can cause hypoglycemia. Alcohol can cause hypoglycemia, or any combination of all those things. So, some things to look for if somebody is having a hypoglycemic episode. Um, they'll be alert and can swallow a lot of times. They may have a medical ID tag marking them as diabetic. Oftentimes they'll be shaky and trembling, cold, clammy, moist skin. They may be confused, lightheaded, dizzy, super hungry all of a sudden. They may feel nauseated. They could have tingling in their and or numbness in their lips, tongue, and cheeks, and they may be sweating pretty heavily. They may also be super hangry. So get them something. So have the person check their blood glucose if they can. Um, if there is no testing available, or it shows a low blood glucose level, or the person has profuse sweating or shaking, what you're going to do is have the person eat 15 to 20 grams of sugar. So using things like juice, a soda, not a diet soda, but a real soda. I shouldn't say real soda. I drink diet soda and zero sugar stuff. Mountain Dew Zero Sugar is awesome. But anyway, not effective if somebody's having a hypoglycemic episode. Their blood sugar's too low. But like soda with sugar in it, regular soda, a candy bar, uh, gummy bears, something to raise their blood sugar level. Okay, wait 15 minutes, recheck their blood glucose if you have access to that. If it's still low or you don't have any way to test it, give them 15 more grams. If there's no improvement by then you need to call 911. So, like, if they're not starting to kind of come to it or anything like that, you need to call 911. So, a few notes. You usually don't need to give near as much to young children. They're so much smaller. Um, much more than that will raise their blood sugar, can like raise it too high. So you need to be careful. With infants, they don't need much. Small children. Anyway, you can try glucose under the tongue for a child that's not like cooperating. So putting a little piece of candy underneath their tongue. Um, and then if you need to be careful that they don't eat too much after they feel better, because that can cause their blood sugar to shoot way up, especially in those that are diabetic. That can also cause a diabetic episode, which is not good. So make sure that you help them to not overeat afterwards. So some things to look for an unresponsive person. They may be staggering or slurred speech, not be able to follow like simple commands, like what's your name, things like that. They may be unable to swallow. It can get as bad as having seizures or be completely unresponsive. So our stuff is pretty much the same, right? If they're unresponsive, call 911. If they're not breathing, start CPR. If they're breathing, put them in the recovery position. Don't give them anything to eat or drink. If you're not sure which diabetic condition they have, you can give them some sugar. Some diabetic people out there actually have glucose injections in usually with their monitor. You can give those, or anyway, you're not really supposed to give them anything to eat or drink because they're unresponsive. You could put like a sugar tablet underneath their tongue or something, but that's about all you could do in that situation. So if somebody has a really high blood glucose, could be caused by not enough insulin, eating too much, if they're sick, they haven't been very active, stress can cause this, or any combination of those things. So some things to look for If they have a medical ID tag because they're diabetic, it will usually be gradual. It's not like all at once. They can feel really drowsy, be super, super thirsty. They may urinate very frequently, um, warm, red, or dry skin, vomiting. Their breath will smell very fruity, and they may have some heavy, heavy breathing. Eventually, they'll become unresponsive. So, you want to give them frequent small sips of water. Have a family member check their blood sugar if you have the ability to do that. If you're uncertain whether it's high or low and they're able to swallow, you still give them sugar. And the reason is when you put more sugar into the blood, causes the pancreas to release more insulin to try and take up some of that sugar. Um, if if the person can't self-administer their insulin, don't give it to them. You don't have the training to do that. Okay, and then call 911 ASAP. So now when talking about abdominal complaints, people with GI problems often complain about abdominal pain that is achy, sharp, or even dull. They may be nauseous or vomiting, and they may have like bowel symptoms like diarrhea or constipation. Okay, so we know where the abdomen's at. Um, the abdomen contains hollow and solid organs. A few examples on the slide here. So, abdominal pain, some things to look for. So, when did it start? Where is it? Is it constant? Or is it intermittent? Does belching or passing some gas relieve it? Do they feel nauseated? Is there any diarrhea or vomiting? Those kinds of things are important to know. Do they feel warm, feverish? Do they have like body aches? Um, does anyone who spends a significant amount of time with a person have similar symptoms? Is there a chance they could be pregnant? Is their abdomen rigid? Right, we talked about that with abdominal bleeding. So, you want to give them clear fluids. You can give them an antacid, place a hot water bottle against their abdomen or heat on the abdomen. Be prepared for them to vomit. Keep them in a comfortable position. So, reasons to seek medical care. If the pain is constant and severe, like even to the point of doubling them over, that's concerning. If they're unable to drink any fluids, if they might be pregnant, they need to see a doctor, especially if it's causing abdominal pain. If the abdomen is really rigid, um, if it's painful to the touch, swollen, those are concerning things. Um, if the pain is relieved by pressure and then suddenly returns upon release, especially in the right lower quadrant, that could be a sign of appendicitis. Um, and so they need to be seen quickly. So, more reasons to seek medical care. If there's bloody, bloodstained, or black stool, or there's blood in their vomit, if the person has a fever, if there's lightheadedness or fainting, if the pain began around the belly button and then moved to the lower right part of the lower right quadrant, that's another sign of an appendix attack. Okay, so nausea or vomiting can occur because of a lot of things. A few examples: mild altitude sickness, motion sickness, a brain injury, intestinal viruses, eating or drinking too much, being emotionally upset, any of those things. So some things to look for: is there also associated abdominal pain? Is there anything concerning in the vomit, like blood or grainy materials? Are they having diarrhea? Is there any signs of dehydration? Anyone near the person has similar symptoms? Or have they had a recent head injury? So some things to do: give the person small amounts of clear fluids, offer some carbs, have the person rest, and avoid being overly active. Position them on their side in the recovery position if you feel like they're going to vomit. Um, so, reasons to seek medical care: bloody or brown, grainy material in their vomit, constant abdominal pain that doesn't go away, if the person faints when standing, if the person is unable to keep fluids down for more than 24 hours, if they have severe and like heavy projectile vomiting, or if the vomiting follows a recent head injury. Those are reasons to seek medical care. So, motion sickness. Motion sickness, usually it's like car sickness, or it can also be on like theme park rides, boats, those kinds of things. Some of the symptoms are nausea, pale skin, cold sweats, vomiting, dizziness, headache, fatigue. Um, Now, if somebody is getting motion sickness, some things to do: sit more in the midsection of whatever vessel they're traveling in, like a plane, a car, train. Try and move more to the middle. The back can be like anybody that's ridden in the back of a van knows that that's where like you feel most of the movement and you get most of the forces. Make sure they're looking ahead and like watching where they're going if possible. On a plane, that's hard to do, but like in a car, have them look out the windshield and watch where they're going. Um, don't read or like look at something other than the direction that they're headed, and avoid overeating at that point. So, home stretch here, guys. Stay with me. So, somebody having some diarrhea. Everybody knows what diarrhea is. The biggest trouble with diarrhea, it's basically the same with vomiting, right? Is unable to keep down fluids, and the person can become really dehydrated. So the biggest thing is you want to replace fluids and electrolytes. So having them drink water and then drink an energy, not an energy drink, excuse me, a sports drink with it, an electrolyte drink. Um, the biggest thing with diarrhea is typically it's viral, which means that it's caused by a virus and it just kind of has to run its course. Like there's not really a whole lot you can do for it. Um, but focusing on keeping the person hydrated is what's most important. So some other things to look for: were they exposed to possible contaminated water or food? Okay. Is there blood or mucus in their stool? Um, are they having any other signs of dehydration? Do they also have associated cramping and or abdominal pain? Some other things to look for: do they have control of their bowels still? Are they feeling feverish? Or do they have any other similar symptoms? So what to do: have the person drink a lot of clear fluids. Try and give very like not strong, mild foods. So avoiding things like that have a lot of seasoning in them, like Mexican food's probably not a good idea. Chinese food, those kinds of things. Focusing more on bland, um, easy to eat foods: soup, crackers, those kinds of things. Bismuth can also help. Bismuth is Pepto-Bismol. It may turn your stool or your tongue black. People who are really sensitive to aspirin should avoid using Pepto-Bismol, but that bismuth is Pepto-Bismol. Okay, so seek medical care if the person is having bloody stools. If there's no improvement after 24 hours, if they have an associated fever or severe constant abdominal pain, and if they're getting dehydrated, those are reasons to seek medical care. Okay, constipation. Hopefully we know what that is. It's when they're unable to use the bathroom. 3 or fewer bowel movements a week constitutes constipation. It usually results from a change in someone's diet. They're not getting enough fluids. If they begin heavy activity, or if they're having a really tough time emotionally, can also cause this. So some things to look for: they may feel really bloated, and their stools may be really hard or dry. So what to do: have the person eat a little bit more fiber. Things like fruits, vegetables are really high in fiber. Encourage them to drink plenty of fluids. Make sure they're well hydrated. Encourage them to stay active. That helps. If there's no improvement, you can try a stool softener like Miralax or caffeine to help loosen things up a little bit. So seek medical care if you're having some severe abdominal pain, if the abdomen is swollen or really painful, or if they have a fever or vomiting with it as well. Okay, so that's the end of this lecture. It was a long one, but we made it through. If you have any questions, please reach out. I kind of did this last minute, and so if you have some questions, I will definitely look into them, try and help understand the best. As far as the quiz goes, don't expect anything crazy. It's going to be pretty simple. Just like every other quiz, you have access to the notes. But thanks for listening. I will be seeing you guys on Thursday. I know there's some football players that are not going to be able to be there, football players that are traveling anyway. I am going to record class on Thursday. For those that have an appropriate excuse not to be there, okay? And even those people are still going to have to send me something, what they learned, and some sort of a password to be able to receive attendance credit, okay? So don't just skip class just because. Thursday is an important day. We're going to be talking about splinting injuries, and there's going to be a lot of hands-on stuff. So it's not one you're going to want to miss if you have any choice, okay? Last but not least, the password for this lecture is going to be what should we say? The password for this lecture is going to be IKEA. IKEA. Okay, go ahead and get that the attendance quiz done. I'll have that up today along with this lecture. Again, I apologize for getting it posted a little bit late, but thanks for tuning in, guys. Have a good day.